The total eclipse is just days away. Millions of people are going to go out to see this special event happen once in a lifetime. But before you do that, you need to take some precautions. Hi, I'm Maureen Russell Hodson, and this is Springboro, Here and There. We are here at Dayton Children's, along with the Chief of Ophthalmology, Dr. Lux. Hi, Dr. Lux.
Hi, Maureen. Thank you so much for coming.
I'm glad to be here because this is so important. It is a once-in-a-lifetime event. People are going to go outside. They're going to want to take a look at this, but they should think about it first, right?
Absolutely. We always say it's a once-in-a-lifetime event, but we don't want it to be the last thing you see. So the important thing about this eclipse is it's right around the corner. We're in Dayton and in the southern community of Springboro. We're right in the path of totality, which is exciting because we'll have the view of the eclipse right from the center of where the moon hits the shadow of the sun. But what that means is everyone's going to want to look at it. And the issue there is if you look at it with just your eyes, then you are at risk of damage from the sun rays. In as little as 2 seconds, you can get the rays of the sun can cause damage to the back of the eye, called the retina, and that's called solar retinopathy or photic retinopathy. And the one way that we know how to prevent it is by using these solar eclipse glasses. And these are glasses that are 100,000 times darker than regular sunglasses. And for them to be safe and accurate, it has to say ISO 12312-2. And if you see that, that's how you know that they're safe and it meets the requirements. And the way that you can view the eclipse safely is you look away, put the glasses on, watch the eclipse, look away, take them off. And if you do that, you won't have any risk of damage from the sun rays.
So this is no joke. I mean, you can't put regular sunglasses on. What about some of these homemade things that people are talking about, putting holes in bags and things like that? Don't try that either.
Well, if your eyes are important to you, I would suggest not.
Understood.
Because we don't know this is ISO international standards, safety standards, and so we know that this is what's been certified. So I cannot speak to any homemade invention, but I can speak to these, and these are available everywhere. And it's very important that it says there will be counterfeits out there. So as long as it says that ISO 12312-2, it's safe. And if you wear glasses, you just wear them over your glasses, but you don't want to look without them. I think that's the key. If you're ever looking directly at the eclipse during the time when it's the total eclipse, you just want to make sure that you have these in your pocket ready to go and they're not broken, they cover completely, and then you look at it.
How long can you look? Can you look for the total time? Is that okay to do?
So there's actually guidelines on the glasses when you look them up, but usually it's we say 3 minutes at a time. It's safe, but as long as you have these on the majority of the time, then it's fine. What I don't want is people to do this and look like that. That's kind of why I'd rather them watch, look away, take them off, and then not look back up. And it's going to be tempting. It's an exciting time. There's going to be, I think, 360 degrees, sunset, sunrise, and we're actually at Dayton Children's. We've partnered with the Boonshaft Museum of Discovery, and they have a lot of great information about the eclipse for kids. And then on our sleeves movement, which talks about mental health. And so we have these safety contracts that you can download from our Children's Hospital website. So as your family, you can sign the contract saying you're going to be safe when you watch the eclipse. And it's an exciting thing to do as a family in a safe way.
And a memorable thing, and we want to thank Dayton Children's because we've also partnered with you all on these glasses. So we are giving 1,000 pairs away at our event on April 8th at North Park. But again, we just want to make sure that people understand you have to have the glasses. Do not take the chance because you will have some type of repercussion.
Absolutely, and it's in a little as 2 to 3 seconds, Maureen. I mean, this is the part where if you look with your bare eyes at this total eclipse and it does affect your eye in 2 to 3 seconds, that's something that can be irreversible, and it's just not worth the risk. Some of the symptoms, so for example, let's say you didn't watch this amazing program and did not and did not get the glasses, which we so kindly have many for everyone. Then the symptoms of damage from the sun it can present in as little as 12 hours, but as long as 24 hours afterwards. And it's usually a blind spot. So people will say they see a blind spot or a black dot, which we medically call a scotoma. You might have wavy lines, or you might see objects small, or you might see light sensitivity. And a headache is another common thing. And so if you have any of these symptoms, I urge you to come see an ophthalmologist like myself, pediatric ophthalmologist, pediatric optometrist, an eye care specialist, because that could be evidence of irreversible solar retinopathy. So I don't mean to scare anyone, but I know that there's no treatment for this that we know of yet. So the only treatment is prevention. So this right here, we can prevent it, but we can't treat it. So if you were to get it, that's why this is so important. We don't have any treatment for solar retinopathy right now.
So you need to make sure that you have a pair of special viewing glasses for this event.
Yes, and these are glasses, if you look through them, you can't see anything else. So you can't drive with them. This is not something you're gonna wear during the whole day.
Yeah.
It is only when you look up at the sun, because that's what blocks the rays.
So we're gonna put them on, we're gonna look up, and then we're going to look back down.
And then take them off. So you're never looking directly at the eclipse without these. And I think that's the safety. Because I've been asked, oh, what about driving? Will it affect? And it won't affect it as long as you're not looking at it. If you look at it, you need to wear these glasses.
And if you're driving, please keep your eyes on the road and anything else that you're doing.
So and do not wear these glasses driving, because then you might get into an accident. But keep them with you, because if you want to park the car, get out of the car and look, then you're ready to go. Right. So we recommend, everyone has these and they fit. And if you're parents, you can supervise your kids and just make sure that they're on correctly. And then it'll be a safe way to view this amazing day that we happen to be in the path.
And we say it's a once in a lifetime event. However, your eyes, you only have one set. So you always need to be and carefully watching your eyes and making sure you're taking good care of your eyes.
We only have a pair and no spare. So we don't, we don't. And it's unfortunate, because I see patients right now, for example, laser pointers. I've had a patient just recently that used the laser pointers in their eye and they got solar retinopathy. So it's something you can get from welding without protection, or sun gazing for too long just now without the eclipse. So the eclipse is it's going to be an exciting time, and so we don't want people to look at the sun longer and without protection. So this is something that I see patients having solar retinopathy from those simple things.
Now, should you ever look at the sun without wearing sunglasses?
No, it's not a good idea. You can get sunburn, you can get UV damage from the surface of the eyes, and usually those are things that take about a half an hour or 30 minutes of looking at the sun. But luckily, there's a response already when people look at the sun. They want to look away because their eyes tear. But solar retinopathy you can get in as few as a few seconds if that UV ray goes and damages the back of the eye. And on this day, because the moon's blocking the sun, there'll be shade. And so you'll think it's safe. And that's where the hazard comes in, because people will think, oh, I can just look, it's not that dark, it's not that bright. But that's where it's wrong, because it's still the UV light. And that's why you definitely need the glasses. For that one case that doesn't, we don't, this is what I hope, if I can prevent one person from going blind that day just by using these glasses, I will be.
Please do. That's why we're providing them, right?
Yes, exactly. So.
Just generally speaking, how early should how early should you have your child's eyes checked?
It's a great question. So the children's eyes are unique from adults in that the vision pathway is developing from birth till 9, and the neuroplasticity of the brain allows you to intervene early with things like glasses, patching, or surgery to correct vision. So in a child, if they have a vision issue, we can actually correct it and change their vision. After 9 or 10, it becomes difficult to do that. So what I recommend is that any child that you notice that has crossing, or they're squinting, or they're holding things up close, those are children that need to have an eye exam. If there's a family history of siblings that wore glasses as a child, or parents that needed them, those are all risk factors. If you fail a vision screening in schools, we're very lucky in our public school system. We have great vision screening programs. Prevent Blindness Ohio helps with that, which is great. And if you fail a vision screening, then it is very important that you follow up with an exam as a pediatric optometry or ophthalmology exam, and they will let you know if you need glasses or something else. But I think the key is that early age group, which is between 0 to 9, that it's very important. And also your pediatrician in their well child visits, they're also doing vision screening. So all of these are time points where people are looking, but in case what you can look for at home is if you're squinting, if you're holding objects close up, if your eyes are turning in or out, if they're abnormal eye movements. These are all examples of needing to go to see an eye provider. Or if you have any behavioral issues. A lot of behavior issues, like attention, not doing well in school, often is because kids can't see. So just getting a pair of glasses can change the trajectory of a child's life. So it's very important that if you notice these things or they're bumping into things, these are all common reasons that you need to see an eye care provider to know if they need glasses.
And glasses are cool now. There's so many different styles and ways that you can wear them. So
very cool. And it's important, pediatric glasses or children's glasses are different than adults. They're special sizes. We have special pediatric optician here at Dayton Children's that will fit the glasses in the right size for the child. And so that's very important as well. As you grow, your eyes change and your head size change. So it's important that the fit is good. So those are all the main things. That it's what I care about is prevention and catching things early. So, every child can enjoy a total eclipse.
I think all your patients are so lucky to have you because I can see how much you care about them. So listen to the doctor. She wants you to wear these glasses on April 8th, right?
Yes.
And make sure that we all get our eyes checked on a regular basis.
Yes, absolutely. And fortunately, we only see children here below 21 and below. But I do recommend, everyone to, get a basic eye exam. I get asked all the time, what are vitamins, things? And I tell the kids, why are carrots good for your eyes? Do you know, Maureen?
I don't.
Have you ever seen a rabbit wearing glasses?
Oh, shoot. I walked right into that.
Yeah. Well, vitamin A is in carrots. So I say multivitamin, like vegetables, anything like on a healthy diet is going to help the eyes. But you can use sun protection, UV protection to help prevent, damage from sun rays, and then total eclipse glasses on the day of the eclipse. But there's not one thing that you can do to help prevent eye disease except for making sure you're going in to see your eye doctor. And if you see signs in a child early, get them in early, well before 6, well before 9, if you don't want them to have permanent vision loss.
And I think a good place to start for information like this is the Dayton Children's website, right?
Absolutely.
Lots of good information there.
Yeah, and you can download all the handouts I talked about, that safety contract, learn about Boonshoft Museum of Discovery, On Our Sleeves movement. All of that's on our website, as well as myself. And we have 2 wonderful optometrists here, 2 amazing ophthalmologists, and our wonderful optician. We're a one-stop shop for children's eyes.
Terrific team.
Yeah, so we are a group and a family, and we're all very passionate to make sure that no child in our community has any problems with vision. And
the thing to remember, I think, is you're right. You have 1 pair, no spare. So take care of them all your life.
That's our Prevent Blindness Ohio has that slogan, which I really like, 1 pair and no spare. But it's really, I think it's interesting. Most people don't realize how important your eyes are until they lose vision. And I think that's what I want to stress is these regular checkups, any signs of anything like I mentioned, eyes crossing, squinting, holding objects close. The best thing you can do is just get an exam early so that we can take care of it. And let us, as the healthcare professionals, I say, don't go on Dr. Google or, come to us. Go to your pediatrician. They will refer you to us. Come directly to an ophthalmologist, an optometrist. We will be champions for your children's vision and help you navigate that. It's not something we expect people to know on their own. So, but these are, if I can help in any way, I'm happy to.
You are a champion. You are a champion. Thank you so much.
Thank you.
Make sure you're wearing these. Again, remember, we are giving them away on April 8th at North Park. Our event starts at 2 o'clock, so we hope we have 1,000 pairs. We hope that we get every single pair away, but there are also other places that you can get them as well, and make sure you protect them.
Yes.
You have 1 pair, no spare.
1 pair, no spare.
All right. For more information, thank you so much for all the information.
Thank you.
For more information, please visit our website, ci.springboro.oh.us. We will see you with your solar eclipse glasses on April 8th.
Safe viewing.